Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. Exchange of gases takes place in which of the following organ? Option A, kidney. Option B, lungs. Option C, liver. Option D, heart. Right answer is option B, lungs. Gas exchange is the transport of oxygen from the lungs to the bloodstream and the expulsion of carbon dioxide from the bloodstream to the lungs. It transpires in the lungs between the alveoli and a network of tiny blood vessels called capillaries, which are located in the walls of the alveoli. The chamber of the heart that receives oxygenated blood from the lungs is the option A, left atrium. Option B, right atrium. Option C, left ventricle. Option D, right ventricle. Right answer is option A, left atrium. The left atrium receives oxygenated blood from the lungs and pumps it to the left ventricle. The right atrium receives blood from the veins and pumps it to the right ventricle. The right ventricle receives blood from the right atrium and pumps it to the lungs, where it is loaded with oxygen. The left ventricle, the strongest chamber, pumps oxygen-rich blood to the rest of the body. Its vigorous contractions create the blood pressure. A muscular enlarge pouch or sac that lies slightly to the left, which is used for temporary storage of food. Option A, gallbladder. Option B, urinary bladder. Option C, stomach. Option D, lungs. Right answer is option C, stomach. The stomach is a muscular organ located on the left side of the upper abdomen. It is a sac-like expansion of the digestive tract of a vertebrate that is located between the esophagus and duodenum. The major part of the digestion of food occurs in the stomach. The ability of the body to defend itself against scientific invading agents such as bacteria, toxin, viruses and foreign body. Option A, hormones. Option B, secretion. Option C, immunity. Option D, glands. Right answer is option C, immunity. Immunity is the ability of an organism to resist a particular infection or toxin by the action of specific antibodies or sensitized white blood cells. Hormones secreted by islets of Langerhans. Option A, progesterone. Option B, testosterone. Option C, insulin. Option D, hemoglobin. Right answer is option C, insulin. The islets of Langerhans are the regions of the pancreas that contain its endocrine cells. Progesterone is produced by the ovaries. Testosterone is secreted by the testicles of males and ovaries of females. Hemoglobin is a protein molecule in the red blood cells that carries oxygen from the lungs to the body's tissues and returns carbon dioxide. It is a transparent membrane that focuses the light that enters the eyes to the retina. Option A, lens. Option B, sclera. Option C, cornea. Option D, pupils. Right answer is option C, cornea. The cornea is the transparent front part of the eye that covers the iris, pupil, and anterior chamber. The cornea is like the crystal of a watch. Which of the following is included in Orem's theory? Option A, maintenance of a sufficient intake of air. Option B, self-perception. Option C, love and belongingness. Option D, physiologic needs. Right answer is option A, maintenance of a sufficient intake of air. Dorothea Orem's self-care theory defined nursing as the act of assisting others in the provision and management of self-care to maintain or improve human functioning at home level of effectiveness. Choices: self-perception, love and belongingness, and physiologic needs are from Abraham Maslow's hierarchy of needs. Which of the following cluster of data belong to Maslow's hierarchy of needs? Option A. Love and belonging. Option B. Physiologic needs. Option C. Self-actualization. Option D. All of the above. Right answer is option D. All of the above. All of the choices are part of Maslow's hierarchy of needs. This is characterized by severe symptoms relatively of short duration. Option A. Chronic illness. Option B. Acute illness. Option C. Pain. Option D. Syndrome. Right answer is option B. Acute illness. Chronic illness. Chronic illness are illnesses that are persistent or long-term. Which of the following is the nurse's role in the health promotion? Option A. Health risk appraisal. Option B. Teach client to be effective health consumer. Option C. Worksite wellness. Option D. None of the above. Right answer is option B. Teach client to be effective health consumer. Nurses play a huge role in illness prevention and health promotion. Nurses assume the role of ambassadors of wellness. The World Health Organization, WHO, defines health promotion as a process of enabling people to increase control over and to improve their health. WHO, 1986. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.